Yeah, Dr. Peter Osborne, and I'm the founder of Gluten Free Society and the CEO of Origins Healthcare.
I was going to ask you, what percentage of kids do you think being diagnosed these days with ADD, OCD, behavioral issues are actually nutritional deficiencies or result of some kind of food allergy in your estimation?
100%. I think that's part of the problem. I think the problem with a lot of kids growing up early is that number one, they're born nutritionally deficient because their parents, are just the same way as it goes back to farming. So we farm from eroded soil. We produce an inferior food. We feed that inferior food to pregnant mothers. Pregnant mothers then have gestation issues, and that child is born nutritionally deficient. Most mothers opt out of breastfeeding. I shouldn't say most, but many do. And now what we're feeding them is a concoction of basically genetically modified corn syrup with vitamins, and that leads to early onset of very poor health and the increased risk for the development of a number of different types of problems. And when you combine that with food allergies and you combine that with today the vaccine schedule, which at one point, prior 1983 was relatively minimal versus the 87 doses that children receive up to the age of 18 today. You're injecting chemicals in an attempt to create health, and that doesn't make sense. That doesn't resonate. Scientifically, it's unsound, and it's never really been proven to work. And it has been proven that many of these adjuvants in vaccines, like mercury and cadmium and aluminum and a number of the other preservatives, actually do have neurological detrimental effects. And so we have this cascade of events of poor nutrition, malnutrition, poor food sources, ingestion of chemicals. And we're not even talking about food chemicals at this point, because many of the food items that people choose to eat are highly processed foods. So you get things like MSG and food colors and food dyes and preservatives. And so what we're facing is a massive epidemic of malnutrition and overburdening of chemical exposure. Of course, the brain's going to malfunction. Of course, the health is going to deteriorate in these young kids trying to develop. Well, I mean, my clinic is based on people that seek me out.
Mhm.
So I could see the conundrum where many doctors who don't understand nutrition, don't appreciate nutrition, if they tried to bring up those types of topics to your average person who doesn't want to hear it, they
Mhm.
probably are going to get a lot of pushback. But my clinic is designed in such a way that the people that need help, that want help, come and have a place they can get it. In essence, I don't advertise. It's not something that I believe in, because I feel like if you're trying to convince people of something, of a message they're not ready open to hear, it's kind of like an alcoholism or drug addiction.
Yep.
If you can't admit that you first have a problem, then there is no solution.
Right.
And it's the same thing with chronic health issues.
Yep. Very true. Um, yeah, let's see. Could you talk a little bit about how diet can create a lack of amino acids for brain chemicals?
Yeah, absolutely. So a lot of children, a lot of adults today are eating a very high carbohydrate diet. 70+% of the average American's diet is carbohydrate. And it really should be closer to, 40%, 40% carbohydrate. Now, why does that matter, and why is that important for amino acids? If we're consuming the vast bulk of our calories from carbohydrate, and there's not enough left, there's not enough room, caloric room left for actual amino acids, the building blocks for neurochemistry. So for example, if their body is trying to produce and make dopamine, which is a very important chemical as it relates to addiction physiology, you've got to have tyrosine.
Mhm.
The bulk of tyrosine as an amino acid is going to come from animal-based meat products, not from vegetarian or plant-based products, and certainly not from what most Americans eat, which is largely processed, condensed and processed food. You've also got other neurotransmitters like tryptophan. Tryptophan's an amino acid that converts into serotonin. Serotonin is very important for the calmative effect on the brain and for mood. And so serotonin and dopamine, both those deficiencies, can contribute to an increased development or an increased risk of addiction and mood disorders that lead to addiction. So, for example, depression. People that are depressed have a greater tendency to pull to pull for medication or to pull for self-medicating, right? And whether that's, whether that's a prescription drug or whether that's a street drug, they're looking for something to saturate those neuronal receptors in their brain because their body doesn't have the amino acids necessary to produce that substance to give them that need.
Yeah, so that was the amino acids. I also wanted to talk about the mineral deficiencies. Could you talk about the lack of minerals in the soil or lack of minerals in a diet or lack of minerals due to gluten causing people's joints to become weaker, cartilage to deteriorate, which then causes them to have surgery in some instances due to like sports injuries or whatever. Then they get put on opiates such as oxycodone to cope. That's happened to my buddy, and then he got in a bunch of trouble. Could you talk about how they can find their way out if there's a deficiency in nutrients and minerals and how they can fix it from a functional medicine standpoint?
Absolutely. So mineral deprivation and mineral deficiency is pretty prevalent in the average American diet, and largely because most people, again, overconsume carbohydrates. And we know that high sugar, high refined diets actually cause loss of minerals through the urine. So even if there were minerals within the diet itself, you actually burn through more of them in an effort to try to metabolize those carbohydrates. Perfect example would be magnesium. Magnesium is lost with aggressive carbohydrate consumption. Zinc is lost with aggressive carbohydrate consumption. If we're tying this to kind of latent stage, what happens when a person has a poor diet with mineral deficiency? They can develop pain syndromes. I mean, magnesium is the body's natural muscle relaxer. And so chronic magnesium deficiency leads to cramps, leads to muscle spasms, that leads to compression of joints. And it predisposes the individual, whether they're an athlete or not, it predisposes them to injuring their joints because when your muscles are tighter all the time, and then you go to try to use them, you run a greater risk of sprains and strains. You run a greater risk of cartilage degradation because of those extra forces and pressures that are being put on the joint. So the next step in modern society today is, let's not figure out why, let's just mask the symptom. You go to a doctor in a traditional medical allopathic model practice, and you go to the doctor with pain or a strain, and the first thing they're going to say is, here's a non-steroidal anti-inflammatory. Here, take some ibuprofen. That's kind of an entry drug, right? When that works a little bit, but it doesn't fix or resolve the actual underlying issue, then they pull out the big guns, right? And some of the big guns, a lot of times the big guns are steroids, steroid injections or oral prednisone or oral corticosteroids. And then when those things fail, they go to the opiates, they go to the heavy hitters, the narcotics. And that's unfortunate because, again, the underlying reason the pain exists is not narcotic deficiency. It's not steroid deficiency. It's not non-steroidal anti-inflammatory deficiency. It has a lot more to do with the nutrition. And if the person's diet were sound, sometimes all it takes is magnesium, or sometimes all it takes is zinc, or sometimes all it takes is calcium, or a combination of those. And we're just really being very surface here, Carson. This is magnesium, calcium, and zinc are just a few minerals, right? There's so many different minerals that we could talk about in relationship to this. So just, we could talk for hours and hours and hours about it. Yep. But my point is that mineral deficiency can lead to degradation of those tissues. It can lead to degradation of muscle. It can lead to degradation of joint structures, cartilage, which causes chronic pain, which then leads to medication, which then contributes to the risk for the development of addiction. And so here you are now addicted to this medication to treat the pain, when in fact, all you really ever needed was to understand why the pain was there in the first place and to address that. And that's just not something that's commonly done in medicine today.
Yep. Yeah, I remember listening to one functional medicine doctor, and he said he was supplementing, he was coaching his kids' hockey team, and he put them on manganese and to strengthen the tensile strength in their ligaments and tendons. And he said hardly any of his kids got injuries, and like all the other teams, they always had people injured and ligament tears and stuff. So yeah, that's just scratching the surface. We could go on a bunch about all the different mineral deficiencies. After doing some research, I found that some natural painkillers, anti-inflammatories, are DMSO, benfotiamine, stinging nettle root, vitamin D, willow bark, cod liver oil, magnesium, and turmeric. Would you elaborate on any of those or add any or take away?
I will make a distinction between natural pain relievers as a solution versus natural things that you can take to solve the problem. And here's what I mean by that. There's allopathic medicine, which is take the chemically related medicine to block your own chemistry to suppress the symptom. Then there's what's called green medicine. Green medicine, an example of that would be take white willow bark,
Mhm.
as a natural non-steroidal anti-inflammatory to relieve your pain.
Mhm.
And but it still doesn't solve why the pain is there. So
True.
again, the delineation is green medicine's fine, it's less toxic,
Mhm.
but it still doesn't solve the underlying origin or root of the pain. And so
Right.
if we really want to look at natural pain relief,
Mhm.
you have to start with the diet, because most of what people eat in terms of their food is inflammatory.
Mhm.
Saturated fats that are derived from the hydrogenation process, not your natural coconut oils or your palm oils, but I'm talking about your man-made oils, right? Your man-made vegetable oils that are saturated are
Mhm.
extremely inflammatory. The
Yep.
glyphosate, as you mentioned earlier, the pesticides are extremely inflammatory.
Yep.
The heavily processed foods with added chemicals can be extremely inflammatory. And research has documented all of this and backed all of this up. So, as opposed to trying to grab for a natural agent to reduce your pain, grab for real food. Start with that fundamental first. Eat real food,
Yeah.
because a lot of the natural solution to the problem is in the diet change itself. And another example of that would be gluten. Gluten, as a general rule, a lot of people have a gluten sensitive issue or gluten sensitivity issue, and gluten is notorious protein for creating chronic inflammation and autoimmune pain. So it can create autoimmune inflammatory diseases in the joints, muscles, tendons, ligaments, soft tissues.
Mhm.
And no matter how many drugs or no matter how many natural products like turmeric or white willow or anything else that you take, if you don't change your diet,
Mhm.
nothing's going to help you.
Right.
You're going to get a temporary relief only. Now, let's say you're changing your diet and you're still hurting and you would like to have some temporary relief as it takes time for that diet to change. What are some things that a person could really focus in on doing? Really, in my opinion, there's two substances that, bar none, work best for pain, and one of them is vitamin C. And
Mhm.
vitamin C is a natural anti-inflammatory. It's very, very potent. And from a quantitative perspective, so how much vitamin C, we're talking about like an average 100 to 150 pound human. you know we're not talking about 200 milligrams of vitamin C. We're talking about upwards of 5 grams of vitamin C to
Mhm.
have good effect.
Mhm.
Okay. And if you mix vitamin C with quercetin, quercetin's a natural plant derived bioflavonoid. It's commonly found in green tea, onions, apples, and other foods. But about 5 grams of quercetin simultaneously. When you combine vitamin C and quercetin, we actually have a name for that. We call it a steroid bridge. And the reason why is a lot of people that are on steroids and find themselves struggling to get off of the steroid due to pain. We
Mhm.
combine vitamin C and quercetin in high doses as a bridge to help them wean off their steroid. And it's a very, very effective way to help them move in that direction.
Yeah. Yeah, that's great. Yeah, I take stinging nettle root, quercetin, and N-acetylcysteine every morning, and I've had chronic allergies my entire life. But ever since I started taking that mixture, I haven't had any problems. Would you recommend Camu Camu for a vitamin C source, or no?
I recommend purely um, reduced, meaning not oxidized. So what does that mean? That means a lot of your vitamin C products are oxidized,
Mhm.
and they're oxidized by the nature of the way they're produced. So they produce them where they're exposed to air, light, and water. And so what you get is you get a vitamin C that's less potent. So the proper way to take vitamin C, I mean, camu camu is fine as a food. Berries are fine as a food. But if you're taking supplemental vitamin C, what I would really recommend is fully reduced ascorbic acid buffered with minerals.
Okay.
Okay. You buffer it with minerals so that it doesn't upset the stomach.
Mhm.
And so you buffer it with minerals like zinc and magnesium and potassium, etc. And the way we produce our vitamin C is under what's called a nitrogen blanket. So we use nitrogen as a blanket to prevent the vitamin C from oxidizing. So it prevents it from breaking down and becoming oxidized. That way, when you get it in powder form, it's fully reduced and it's not half used up. Because otherwise, what happens? You think you're taking 3 grams, but you may only be taking the equivalent of 1 gram because a big chunk of what you're using is actually oxidized. So it really is hurting you more than it's helping you.
Okay. Does liposomal vitamin C, do you recommend that or no?
I don't, And not because it can't be effective. Liposomal, there's some great research on liposomal vitamin C, but the reason I don't recommend it is because gluten is so pervasive in addiction, in the field of addiction. I've not yet met a person with drug addiction that wasn't gluten sensitive.
Mm-hmm.
Now, that doesn't mean they don't exist, but I've not seen it. And that being the case, these liposomal products are corn. A lot of them are corn derivative, and a lot of your vitamin C in general is derived from genetically modified corn. And so what they're not telling you is that this vitamin C might have glyphosate residue, right? So it's important that the source of vitamin C is not only organic,
Mm-hmm.
but it's also not corn or grain derivative.
Yeah. Yeah. Yeah, I was wondering if you could talk a little bit about that too, because I noticed like my health got way better after I got off the gluten mimickers. So like a lot of people say they're gluten free, but they're still eating like rice and corn, all these things. And I was wondering if you just talk about how that can be causing the inflammation as well, causing the chronic pain.
Yeah. So, the definition of gluten, the accepted definition of gluten in the food industry today is that it's the name of the protein gliadin. So gluten, when we talk about gluten, is really, we're referring to a protein called gliadin. And gliadin is found in wheat, barley, and rye. And so the food definition is if it's wheat, barley, and rye free, down to 20 parts per million, then we can label that food as a gluten-free food. But that is actually the governmental definition is actually incorrect scientifically. And that's where the problem comes in, because corn, as an example, has a form of gluten called zane. And there have been a number of research studies that show that that form of gluten is actually just as toxic as wheat gluten.
Mm-hmm.
We've seen similar studies on rice. And so a lot of your gluten-free products, for example, are made from corn or rice.
Yep.
And they're being labeled as gluten-free, even though technically they're not really truly gluten-free. They're gluten-free based on an antiquated definition that the government uses, which again, in my opinion, is very incorrect. But you also have other foods that can mimic gluten. So there's foods that contain gluten, they just don't contain the traditional gluten that we call gliadin. But then there's foods that can mimic gluten.
Mm-hmm.
One of the biggest is one of the biggest is dairy.
Mm-hmm.
The casein, especially in the modern dairy that's produced today especially from our cow herds. Our cow herds today, most of them produce what's called A1 casein, which is a type of casein that very much resembles gluten and can create the same types of symptoms.
Yeah.
One of the other big gluten mimickers that I see as pervasive is called meat glue, otherwise known as otherwise known as tissue transglutaminase. And not tissue transglutaminase. I'm sorry. It's microbial transglutaminase.
Okay.
And microbial transglutaminase is a pink slime derived from bacteria.
Yep.
There's a species of bacteria that we produce this slime from, and what it's used for is it adds texture, and it gels food together. So like if I wanted to make a hot dog or bologna or something like that, I would use this bacterial pink slime with the meat, and we would make a preformed piece of meat, right? And what one of my colleagues, Dr. Aaron Lerner, has been researching for a number of years is the fact that this meat glue actually contributes to the same type of problems that we see in somebody with gluten exposure, right? Somebody who has a gluten sensitivity, who's eating gluten, we see the same kinds of symptoms that we might see if they're also eating meat glue. So common sources of meat glue, aside from processed meat, oftentimes your yogurts and dairy products and ice creams and confections and imitation crab meat. These are all sources of meat glue. And again, if you're eating those things thinking and you're trying to be gluten-free and you're trying to avoid it, but you're not aware of that, then you might actually be maintaining your illness and not knowing why.
Could you briefly touch on, I mean, this is a huge category, but if there's anything to relate, thyroid, hormones, diabetes, adrenal fatigue, any of those, and how they are related to chronic health issues and why people would start taking opioids to try to fix those problems?
Yeah, I think that the source of most, we'll just say, whether it's opioids or alcohol or other self-medicating or prescriptive medicating to manipulate the way we feel, right? So that ultimately, for many people, they're depressed or they're in pain, or their depression is painful to them, right? So like there's different forms of pain. We think of pain typically as physical pain and not as emotional pain or mental pain or mental anguish. But a lot of people grab for different chemicals when they're under pain like that. So a lot of that actually, if we understand pain, a lot of pain begins when organ systems start to dysfunction. So, if we're looking at like the thyroid as an example, the thyroid produces a hormone called T4, thyroxine, which then is converted into another hormone called T3, which is the active form of thyroid hormone. If there's a problem in the ability for the body to make thyroid hormone appropriately, and a common diagnosis would be hypothyroidism or Hashimoto's, which is a form of autoimmune hypothyroidism. These diseases are this one is very much gluten related. Gluten can actually cause your body to make antibodies against your thyroid. And so your own immune system will start to attack it.
Yeah.
But we'll also see nutritional deficit playing a role in hypothyroidism. So for example, there are about 17 different nutrients that your body needs in order to properly make thyroid hormone and for that thyroid hormone to do its job properly. Okay, so some examples include, to make thyroid hormone, we need tyrosine, which is an amino acid. But we also need iodine. Iodine is a very important mineral obtained from seafood and seaweed and things of that nature. We need vitamin B2. We need vitamin C. We need zinc. We need vitamin A. We need vitamin D. We need omega-3 fatty acids to metabolize appropriately thyroid hormone. And so a person who has a poor diet or is malnourished, the symptoms of hypothyroidism oftentimes are fatigue, chronic fatigue. So we'll see somebody gravitate toward medicines that can elevate them, like Adderall, right, or Ritalin. These are stimulants.
Yep.
Other symptoms, though, of low thyroid, might include pain, because low thyroid causes a lot of joint pain and it causes a lot of muscle pain. So we'll see those individuals gravitate toward the pain medications and toward that family of different drugs. And then again, it's just a matter of gravitation. Once one medicine quits working, they go to the next, and they go to combination, and just, they go up that chain or that ascension of different options in pain management. So that is why it's important to understand that much of the time for people, the thyroid malfunctioning can actually create that pain. And it's not just the thyroid. You also mentioned the adrenal glands. The adrenal glands are, in a nutshell, the adrenal glands are the organs that help us cope and adapt to stress, right? What do a lot of people reach for drugs for? Because they can't cope, right? They're not coping with stress. They're not coping with the day-to-day in their life. And so that drug helps them shut off so they don't have to cope, right? Alcohol helps them shut off. Opiates help them shut off.
Yep.
Well, what happens is the adrenal glands, when they're overworked and overwhelmed, so with chronic stress, and this is what happens is initially when a person's under acute stress, meaning short-term stress, the adrenal glands will turn up and they'll produce adrenaline and they'll produce cortisol, the hormones of stress, and help your body deal and cope with that stress. And then the stress goes away and then you get to rest, right? And your adrenal glands get to recover, and then everything's okay. But in today's world, so many people are under chronic, never-ending stress, right? Maybe they work a job they hate. Maybe their boss is always on them. Maybe they're in a relationship that is toxic, right? There's just a lot of different reasons why a person might be under chronic stress. Just look at the year 2020, 2021, right? With all the lockdowns and everything else. So my point in saying that is those adrenal glands, when they're under acute stress, they can respond and recover. When they're under chronic stress, they're constantly trying to keep up. And so just imagine if you were a person and you went to the gym every day and you never let yourself have rest days or rest weeks, your muscles over time, you would get overtraining syndrome and you would wear yourself out and you would have a lot of problems. Well, the same thing happens to your adrenal glands. When they're being demanded of all the time and they never get rest, they wear out. And that's what many doctors call adrenal fatigue or adrenal burnout. Well, the problem with that is adrenal fatigue, what happens is two big hormones that shut down production. One is cortisol. The other is DHEA, dehydroepiandrosterone. And that hormone is important for the growth of tissue. So it's what we would call an anabolic steroid precursor. It's a precursor in guys. It's a precursor to testosterone. In women, it's a precursor to progesterone. And really in both guys and women, because we all make both of those hormones. But what happens with low DHEA in guys is their testosterone levels can start to drop. Well, low testosterone causes muscle atrophy, muscle pain, right? So now we're back in that pain cycle again, right? And then same thing in females. Low progesterone causes a lot of menstrual irregularities, menstrual pain, menstrual cramping,
Mm.
but also remember that DHEA, before it even gets to progesterone or testosterone, it's an anabolic hormone. It helps the body heal and repair tissue.
Mhm.
So if your body is naturally, your tissues are naturally cycling. They're breaking down and they're building and making new tissue. So, use the skin as an example. Your skin sloughs off and you have brand new skin, every several weeks,
Mhm.
right? It's just layers of skin that push up to the top. As the top layers die off, they slough off,
Yeah.
right? And the bottom layers push back up.
Mhm.
That's a normal process in all of our tissues. It happens in all of our tissues. Our old cells die and make room for new cells to occur to be born.
Mhm.
And when you don't have adequate anabolic hormone, that means the metabolic function of healing and repair and recovery slows down and is diminished.
Mhm.
So, for example, if you were to go for a walk and maybe you were low in DHEA, you were low in cortisol, you would be more prone to injury. You would be more prone to your muscles breaking down easier and not healing or repairing as well. And
Mhm.
now multiply that by a month, and then 5 months, and then 5 years, and that's the progression of chronic degenerative pain, degenerative arthritis. But the other hormone that your adrenal glands produce is called cortisol.
Mhm.
Cortisol, now cortisol is a steroid. It's
Mhm.
it's also known, oftentimes referred to as a corticosteroid.
Mhm.
And what does a corticosteroid do? It's an anti-inflammatory. It's what it does. So we make our own cortisol to fight inflammation. It's our body's natural fire truck, if you will. It puts out fires, and we always have fires in us. Inflammation is not evil.
Mhm.
Inflammation is not bad.
Yeah.
Chronic abundance of inflammation is what destroys us,
Yeah.
right? So when we have an overabundance of inflammation and we don't have the ability to control it because our adrenal glands are so tired they can't produce cortisol
Mhm.
adequately, then we become more and more pained. Like we become more and more in chronic pain.
Yeah.
And one of the things that happens when you're in chronic pain is it changes the morphology of the way your nerves receive pain. So your nerve receptors are largely responsible for transmitting pain messages from wherever you hurt to your brain,
Mhm.
right? And what happens over time is the longer a person's got chronic pain, the biochemistry of the way those nerves are firing starts to change.
Yep.
And this is why, for example, drugs like gabapentin,
Mhm.
okay, which are used for neurological pain, are given because they alter the way the nerve receives pain. So, pain can be there can be traumatic pain, there can be chronic inflammatory pain, but there can then, if it's long enough, it can turn into neurological pain because it changes the nature of the way our nervous system reacts, responds, and perceives pain. And this is another reason why people graduate from pain medication to pain medication and they go all the way up the chain. This is, the whole we'll say profession of pain management, right? Which is generally we start them out with low things and then we graduate them up to the higher and higher, the bigger and stronger pain medications, the narcotics, the opiates, those types of things. My opinion, that's the crux of the problem is most pain management doctors don't have a clue about the actual biochemistry of how pain begins and how pain progresses and how pain advances.
Yep.
They only know about the biochemistry of pain suppression, but they don't understand the origin of pain. And that's a fundamental problem because people go to pain management doctors and that's exactly what they get. They get their pain managed, but they
Yep.
don't get their pain resolved. And that's, in my opinion, it's very sad and it's very tragic because a lot of these people, chronic pain changes the behavioral pattern in,
Mhm.
in a lot of different ways. And for some ways, it changes the mind behavioral pattern, and people gravitate toward heavy drug use, toward heavy alcoholism as a result of being in chronic pain. And they start mixing their prescription drugs with over the counter drugs just
Mhm.
to get the relief. But then you also have the psychiatric component, which is when you're in chronic pain all the time, it changes the nature of your outlook. There's depression that comes along with that. With depression, that generally leads to inactivity, right? When somebody's depressed, they don't feel like exercising. And we know that one of the most natural and effective pain relievers is the enkephalins and the endorphins that are released as a result of exercise,
Mhm.
right? So these people that are in chronic pain, psychologically they get depressed, they don't want to exercise, but also the pain, restricts their movements and their motions. If their pain is in their knee, they're not going to go running. If their pain is in their arm, they're not going to try to do push-ups. You see what I'm saying? So like the very nature of the pain self-feeds. It alters their behavior, changes around modifying their life, around trying to avoid pain.
Mm-hmm.
And oftentimes what has to happen with these patients with addictions and these problems is they have to embrace pain through rehabilitation,
Mm-hmm.
right? Because they have to re-engage their body. They have to reawaken their body, and they have to start turning on the right pathways and the right systems and re-engage that, because part of overcoming addiction is making your own natural endorphins and enkephalins.
Yep.
So that's a big part of it. And, another big part of that is supporting the body nutritionally so that we can saturate the receptors in the brain that are typically saturated by, morphine or OxyContin or some of these other drugs, right? And even alcohol, these receptors that are bombarded in the brain, when you start taking away the drugs, those receptors go crazy, and that's what creates the side effects. That's what creates the shakes, the jimmies, the chills, the vomiting, like just the horrific side effects of withdrawal.
Yep.
And so that, aside from the physical component that's necessary to go through rehab, you've got to have physical therapy going through rehab to be, in my opinion, to be fully successful. But you also need biochemical therapy through the form of high dose nutritional therapy to combat that. So in my opinion, some of the best things to use for chronic addiction, to overcome chronic addiction, and probably some of the most well-researched as well. One of them is niacin. Niacin, nicotinic acid. The research on that goes back to the early 1930s, and we've seen miraculous things in controlled trials and studies. I've seen them in my office.
Yep.
But many doctors before me. I mean, I was the benefactor of their knowledge and of their research studies. But niacin, 500 milligrams a day, is a good starting place for somebody who's trying to overcome addiction and to minimize their withdrawal side effects.
Yep.
Vitamin C, when you combine niacin and vitamin C together, they're synergistic. I mentioned vitamin C earlier for pain, but vitamin C, to the level of 5 grams a day combined with niacin at 500 milligrams a day can be a very effective combination to help overcome those withdrawal symptoms as a person's trying to overcome that addiction.
What advice would you give to people struggling with addiction to get clean? Those are the people who are ready to get clean, but their bodies still mess up. Like I was thinking, amino acids, dopamucuna. I don't know if you've done much research on that. Tyrosine, N-acetylcysteine, milk thistle to help heal the liver from all the toxins that they put in. B complex, DIM. I was wondering if you would recommend any of those.
So from a very strategic perspective, the first thing I would say, if you're struggling and you're trying to overcome, work with a practitioner who understands what to use. All those things you just mentioned are great, by the way. I would say those are all great things, and we'll talk about that too. But sometimes what happens with addiction is, I'm gonna give you an example. What you can scour the internet and read about in terms of what to take is not always going to match what your needs are. As a unique individual, everybody is a unique individual. And if we're talking about chronic drug use, one of the side effects of chronic drug use is chronic malnutrition. And it's because many of the drugs, especially alcohol, cause nutritional deficit.
Yeah.
And so, for example, let's say you're using 4 or 5 different things that you read about, but you're missing something that your body's actually low in and you didn't even know about it. And so testing is very important. One of the things I do with anyone who comes through that is trying to get nutritional support is we test their vitamin and their mineral status, right? We actually do specialized testing to measure intracellularly what their vitamin mineral status looks like. And that way I can be very, very targeted and very specific. Like I can use there are things I will always use. For example, what I mentioned a minute ago, I will always use vitamin C at higher doses. I will always use niacin.
Yeah.
And that's because nothing has a better track record for overcoming addiction than niacin and vitamin C. I mean, my experience, very, very high cure rates from addiction. Yeah. And in research experience, the cure rates as high as 50, 60% versus, let's say, the cure rates of your traditional go in and check yourself into a rehab facility where you do talk therapy and things of that nature. 10%, 8% cure rates in that type of, well, taking niacin and vitamin C get you to 50, 60%. So it's definitely worth doing, right? And then you couple that with specificity. So specificity would be get the right tests to measure your nutritional status and really give your body what it needs.
Right.
Okay. And then couple that, there's 7 fundamentals that have to be applied no matter who you are if you're trying to overcome addiction. The first fundamental is diet. One of the things that has to also be measured and should be measured is food sensitivities, food allergies, food intolerances.
Yep.
And one of the reasons why, Carson, is that you have, I'm going to use gluten as an example. One of the proteins, when we break gluten down, one of the proteins that gets formed is called gluteomorphin.
Okay.
Okay. And it acts like morphine.
Okay.
Okay. So if you're eating gluten, you're basically, and you're also taking a morphine-like drug.
Yeah.
Your gluten is contributing to that addiction. This is why a lot of people who have addictive properties, what do? They go for they binge eat.
Comfort food.
Right. They binge eat the cakes, the cookies, the things like that, because there's actual natural morphines in them. Same thing with dairy. They do this. Dairy has caseomorphin, which is a type of morphine protein in dairy. So a lot of people have problems with gluten, problems with dairy, even problems with other foods. Remember, food is a drug. It's amazing. Food is the only drug that we don't classify as a drug, right? Most doctors have zero respect for food, but what is the definition of a drug? A drug is defined as anything that makes you think, feel, or act and behave differently. Right. And food fits that to the T.
Yep.
So we have to look at food sensitivity. So looking at food so that you know how to change your diet is very critical. That's one of the 7, again, I'm talking about 7 fundamental things. So food. The second is identify chemicals. Chemical exposures, and chemical exposures can come from a variety of different places. And when I say chemical exposures, I'm not talking about just necessarily the drugs from the addiction.
Right.
I'm talking about the chemicals in our environment, the glyphosate, the pesticides, the food dyes, the preservatives that can also alter behavior and have addictive qualities and have mind altering or mind bending properties to them. So looking at chemicals is very important. And so having that measured, it becomes, in my opinion, a part of a fundamental process if you want to have great success. The third thing is to look at the gut. The gut, and the reason why we want to look at the gut is because you mentioned earlier amino acids, and you were talking about neurotransmission. And so, your gut produces 90% of all the serotonin that your brain uses.
Right.
It produces 60 to 70% of the dopamine. Right. So if the gut has imbalance in it, and there are a lot of different examples of gut imbalance, but one of the types of gut imbalance is common in alcoholics, common in drug addicts, is yeast overgrowth.
Right.
And part of the reason why is their diet is so carbohydrate heavy. And so they've created a yeast imbalance, and that yeast alters the biochemistry of the gut, leading to deficits in the brain of dopamine, of serotonin. And so looking at the gut can actually alter your success in the way that you think and feel. And so the microbiome can be measured, and digestion, and how well a person digests and breaks food down. Those are things that can be measured, because I said food was important, but so is the breaking down of that food to extrapolate vitamins and minerals, right? So we want to look at food, but we also want to look at the gut and the status of the gut, but also the status of the accessory organs to the gut. Those are the organs that help the gut do its job. That's your liver, that's your pancreas, right? And that's also your gallbladder.
Right.
The pancreas produces digestive enzymes and bicarbonate and insulin, and it helps to regulate how we look at food and how we digest food. The gallbladder helps us to digest fats, and it also serves as a toxin binder. So bile that's produced by the liver but secreted by the gallbladder is a toxin binder. And so a lot of the times when we're going through addiction withdrawal, we're purging toxins.
Right.
I'm saying, and when we're purging toxins, this is where a lot of the side effects of withdrawal happen. That's why niacin and vitamin C are so important.
Yep.
Because niacin vasodilates, and it helps you purge those toxins faster. And in many research studies, and even in my own personal clinical experience, I see high enough niacin levels oftentimes lead to a complete absence of withdrawal, meaning they don't even feel withdrawal when they're trying to get off the medicine. So you've got to look at food, you've got to look at chemicals, you've got to look at the gut.
Yep.
Okay. Those are all fundamental things that have to be looked at. You have to have adequate sleep.
Yeah.
Okay. No healing occurs without adequate sleep.
Right.
There's no such thing as a night person. A lot of drug addicts stay up really late till 2, 3, 4, 5 in the morning.
Mhm.
Um, you've got to get your sleep balanced. Your circadian rhythm is set for healing and repairing between the hours of 10 p.m. and 2 a.m. That means your sleep window needs to be in that time frame, that 10 p.m. to 2 a.m. time frame. That means get to bed and be asleep by 10 and sleep at least until 2 a.m., preferably longer on both ends, but that's a crucial time frame for healing and repair.
Mhm.
Then we also have exercise. I mentioned rehabilitation earlier, and how, with addiction, people have, one of the natural ways to saturate your brain tissue with endorphins and enkephalins is to actually start exercising. And you can kill two birds with one stone here. You can exercise outside and you're going to get sunshine.
Right.
A number of very, very important mood altering effects of light,
Yeah.
right? Of getting the full spectrum of light. And most people spend, their days indoors, right? Dark,
Mhm.
without any of the full spectrum lights that are necessary that the sun typically would provide for you. So being outside, exercising, very important. Clean air is very important. Clean water, filtered water is very important. And then stress management.
Mhm.
There's a general rule: know thyself, right? For addicts, know thyself, know what your weaknesses are, know what are your triggers, know what things that if you put yourself in certain situations are going to want to put you into a trigger where you use again. So
Mhm.
know yourself, right? And keep yourself away from those types of stressful situations that might be triggers for you. So, because stress management is just as important, because generally speaking, when life is easy, it's real easy to follow a certain pattern. But the second life throws a curveball at you and that big stress comes, the addict generally wants to jump to use,
Right.
right? Because again, going back to what we were talking about earlier, their coping mechanism, their incapacity to deal with stress, and they're so used to, and it's not even just a drug addiction, but it's a psychological, psychosomatic addiction to making a choice when they're under stress.
Right.
Does that make sense? Some people bite their nails, right? And it's psychosomatic. Some people, opt
Yep.
for the drugs, but you want to know yourself and try to keep yourself out of that stressful situation that's going to trigger, that desire to want to use and want to, to break away from what you're trying to do to accomplish, overcoming that addiction.
Yeah. Great. Yeah, those 7 things are great. Yeah, you talked a lot about the niacin. Have you ever heard of Dr. Yu's protocol with the niacin?
No, I can't say that I'm familiar with Dr. Yu personally.
Okay. Yeah, he just said, he was having people take high dose of niacin and then get in the sauna and to help get all the toxins out of their system.
That protocol, I don't know if I don't know if that's him, and he gets credit for it originally. I don't know. I can't speak intelligently about that, but the combination of niacin and infrared
Mhm.
is a fantastic combination,
Yeah.
because niacin vasodilates, and so it starts to what we actually know that it does is it mobilizes toxins from your fat cells.
Mhm.
And then when you're in a sauna, you're sweating that out quickly. And
Yep.
it's not, because typically with drug addicts, their livers are not working well. And then what you mentioned earlier with milk thistle, silymarin, the active ingredient in milk thistle, is very important to help the liver, because as you're mobilizing those toxins from the fat cells, the job of the liver is to convert those fat soluble toxins into water soluble substances.
Right.
And then when you're in a sauna, you can sweat out those water soluble substances, but you can also pee them out through your kidneys, right? So supporting the kidney, supporting the liver, and deep breathing. So
Mhm.
there's 4 routes of excretion of toxins that you want to support:
Mhm.
sweating, pooping, peeing, and breathing.
Right.
Those 4. So if you're constipated, you're backing up. Those toxins they're backflowing back into you. If you don't ever sweat, those toxins aren't coming out efficiently. If you're dehydrated and
Yep.
you're not urinating adequately. So I would just say, make sure you're having at least 1 bowel movement a day. Make sure you're peeing full urine voids 6 times a day or more
Mhm.
during a detoxification. If you have access to a sauna, like an infrared sauna, 4 to 5 days a week. Um, or more if you can tolerate more. You just have to, one thing you have to be careful of in a sauna is dehydration. So just
Yep.
making sure you're getting, replenished with your fluids. And then deep breathing. Most people today sit in this posture forward position.
Mhm.
So like if you're sitting at a desk, for example, your
Yeah.
lung capacity is reduced by about 40%.
Okay.
If you're standing straight and tall, Your
Yeah.
lungs open up, your rib cage opens up, you get more oxygen in, but more importantly, when you breathe, you're expelling toxins.
Hmm.
So focusing on your breathing, right? Being aware and being cognizant of your breathing. Some people find that meditation is very helpful because it trains them and teaches them how to do deep breathing properly. Some people find the practice of yoga, where you're doing intentional breathing, belly breathing, very, very helpful because it also, again, it serves as a detoxification route for those toxins that are being released as you're taking that niacin.
Is there anything that you think the doctors and psychiatrists are doing right now that you believe simply are not working with people with chronic health issues, depression, anxiety, withdrawal? And also, if you could touch on them prescribing things such as Suboxone.
So I would say this. I would say what they're doing wrong in psychiatry today. Are you familiar with Abram Hoffer?
Oh yeah.
Probably
Oh
so.
yeah, for
Yeah,
sure. Yeah.
yeah, total pioneer in this field.
Niacin, schizophrenia and stuff like that. Yeah.
Yeah, niacin and schizophrenia and his adrenochrome hypothesis. But he was a psychiatrist. He actually is a really great book for
Yep.
those of you that are interested in reading more about him, called Adventures in Psychiatry.
Hmm.
It's just a great overall. It's not super deep heavy in the science, but it's a great book of his work. And Dr. Hoffer was a psychiatrist, and one of the things that I can credit him for in a really big way is he's one of the founding fathers of the term orthomolecular medicine. Orthomolecular means right molecule,
Yeah.
and niacin is an example of using the right molecule.
Hmm.
Because niacin affixes to the opioid receptors in the brain, and it affixes to the addictive receptors in the brain, and it saturates them so that they're being saturated and they're being activated without the drug having to be present. This is why that works so well. But how did they find all this out? How did doctors like Dr. Hoffer and Osmond, how did they find these things out? They did testing, they did biochemical testing, they did analysis.
Yep.
And so when you ask me, what are doctors and psychiatrists doing wrong today? In the field of psychiatry, it's a purely subjective field.
Hmm.
It's a subjective field, but it uses objective chemistry as a tool based on subjective conversation. So you sit down, you talk with your psychiatrist, and they say, well, let's try this.
Right.
Let's try that, but not once. If you go to a traditional psychiatrist, will your psychiatrist tell you, let's measure your dopamine,
Right.
let's measure your serotonin, let's actually get objective data by which that we could understand how better to make the recommendation. Even if they were making the recommendation of a drug, different drugs have different mechanisms of action.
Yep.
And so if they're making a recommendation about a particular drug, wouldn't you want to know that if you were recommending an SSRI, that
Right.
person's serotonin level was low instead of their serotonin levels were perfectly normal, and the SSRI probably won't do much for them. So my point is objective data, objective science is lacking. And but unfortunately, they have the prescription pad to write very powerful mind altering, mood altering medications that have the potential for a ton of side effects. I mean, the example, if we're talking about, diseases like bipolar, schizophrenic, schizoaffective, depression, drugs like Geodon and Abilify and SSRIs. I mean, these drugs cause massive malnutrition. A lot of them are linked to the development of diabetes, which, by the way, diabetes begins the process of addiction because when blood sugar is low, it creates gravitation toward an increase in pain and increase in inflammation. And so it pushes people more toward that addictive quality or that addictive side. So it's like, again, I think you get my point, is that if we have zero objective chemistry analysis, yet we're using very, very potent drugs that have very, very potentially debilitating effects. And that's the standard of care. And
Yep.
if we look at the success rate, what's the success rate in treating schizophrenia and bipolar disease? What's the success rate in treating schizoaffective disorders or ADD or ADHD? It's
Right.
virtually 0%.
Yeah.
Right? There is not a success rate. There are people that do well for a time on certain medications, but generally speaking, the body overrides those medications if we create a scenario where the drugs quit working because
Yep.
the body's developed an override around them, and then the drugs just change, right? So there's really no success. There's just a constant management, and the goal of healthcare shouldn't be to manage somebody's problems.
Right.
The goal of healthcare should be to empower somebody to understand what they can do to make meaningful changes in their life, to become self-aware, right? And self-serving to their own health, right? And that requires time, it requires education. And psychiatry today, they do spend time with their patients. Unlike your standard medical doctor who you might get 5 minutes, they're swirling in and out the door. But the time that they're spending, talk therapy, if it worked, we wouldn't have mental disease anymore.
Yeah.
You know what I'm saying? Like if talk therapy worked, if going into a room with a complete stranger and spilling your guts out worked,
Yep.
We wouldn't have chronic illness the way that we do mentally. And we still have a massive quantity. We have probably the highest level of chronic mental illness that we've ever seen in the history of mankind,
Yep.
at least in recordable history. And that's with the current therapies and the current drugs and the current standards of care. So those things are obviously not working. It's time to make a change.
Yeah. No, that's funny that you brought Dr. Hoffer up. I took an abnormal psychology class a couple of years ago, and I went up to my teacher afterwards because I was doing a project on schizophrenia, and I said, this Dr. Abram Hoffer, he's treating niacin or treating schizophrenia with niacin, and she said, no, that's impossible. If that was true, then they would be using that today. And I was like, oh, okay. Kind of funny.
Well, what happened is they it was really somewhere in the 40s and 50s that this was actually kind of when penicillin came on. There was the race to find a drug for everything because it was so profitable, the production of that medicine, and penicillin by its own merit saved millions and millions of lives, right?
Mm-hmm.
But it also made a lot of money. And so it created a pharmaceutical craze, if you will, that instead of looking at vitamins, minerals, and things that were actually essential for the body to function,
mm-hmm.
right? Because there's a reason why we call them essential nutrients.
Yeah.
There's 40 essential nutrients: vitamins, minerals, water, carbs, fats, proteins, nucleic acids, right? Those are the essential nutrients.
Mm-hmm.
And we kind of quit focusing the study on those things in the endeavor to seek out new chemical means to manipulate the body.
Yeah.
The next wonder drug. And it's a disfortunate that was the case.
Right.
Because the researchers before, again, the 30s, 40s, 50s, there's stellar research. And a lot of times, if I really have a question I can't solve in my practice, I dive into that because those guys were hardcore chemists. Right. Those guys, I mean, the Linus Paulings of the world, those guys were hardcore chemists. They dealt in fundamental sciences, and they had great research. Whereas what we see today, unfortunately, there's not a lot of funding. There's not a lot of money going at nutritional research. And there's so much, even if we do have good research nutritionally today, but a lot of it is squashed, meaning there's oppositional research that's done on purpose to try to squash it. I'll give you an example. I was invited years ago to University of Texas Medical Branch in Galveston
mm-hmm.
to participate in a study on the use of CoQ10 in congestive heart failure. Mm-hmm. And because that's one of my areas of expertise, and the doctors there had designed the study, and they wanted to bring me on board. And part of why they wanted to bring me on board was because they wanted me to donate, I have a supplement company, and they wanted me to donate my CoQ10 and for the study. So they gave me the study parameters. We were having this meeting. I looked at the study parameters, and I looked up and I said, why did you design the study to fail? And their faces turned super red. Like I caught them, and they didn't realize. They thought, here, this guy, what does he know? He's not an expert. Yeah. Anyway, their study design was designed to fail. And so I looked at them and I said, I'm not going to participate when you're going to try to defame CoQ10, when we already know CoQ10 has been used in numerous studies to treat congestive heart failure, to treat hypertension, right? To treat mitochondrial dysfunction, and it works.
Right.
And then their answer to me was, well, we're just trying to make sure it's safe. I said, that's already been done. We don't have to go back to that. I said, I'm done here. But my point is, that's oppositional research. You actually have drug companies fund research that's designed to fail to make a supplement look bad. We've seen that with vitamin E. We've seen that with fish oil and a number of other nutrients. Yeah. And so you get this conflicting story. And so like the person on the internet who's just trying to figure out how to be healthy, they come across an article on vitamin E causing cancer, right, and it's based on a study, but what they don't know, because they're not scientists, is that study was designed incorrectly,
Yeah.
and it doesn't really cause cancer, and it's just very misleading, but
Yeah.
it scared them,
Right.
right? And so it created enough doubt in their mind that to make them think, oh gosh, vitamin E is dangerous. Yet at one side of their mouth they'll say that, but then on the other side of their mouth they'll say, well, yeah, give me that vaccine, or yeah,
Right.
give me that drug,
Yeah.
right? When all drugs come with a cost,
Exactly.
vitamins don't. I mean, unless you're just, you know, how many people have died that have been reported in the medical literature from a vitamin overdose? It's
Right.
very, very few, right? I mean, you look at how many people died last year of aspirin, and it was about 13,500 people
Right.
from over the counter aspirin.
Yeah. And
That
God
is
forbid
far
if
more
you took this
dangerous than
vitamin
any
A or vitamin
vitamin.
D. Yeah.
Yeah.
Yeah, I think I don't want to keep you much longer. I appreciate, all the time you've spent with me today. This has been great. Just I was wondering how someone can make an appointment with you if they have any chronic pain issues or want to know more about functional medicine approach, or your YouTube channel, your website.
Yeah, if they're interested in coming to see me, we could do that in person. We can also do that in video consultation. But they can call my office, Origins Healthcare, and that's 281-240-2229. If they want to learn more about the gluten-free diet and how diet change could make a major impact, they could pick up a copy of my book, No Grain, No Pain. It's available at all major bookstores. It's available on Amazon. They could also reach out to glutenfreesociety.org. That's my foundation. And there's a ton of free information there that, our mission, Carson, is to save 100 million lives. That's what we're about. That's what our life, our total mission is about saving lives, and
Yeah.
doing so in a manner where we exchange free information and research so that people can make intelligent, informed consent decisions about how to improve their health.
Do you have any last words of encouragement, wisdom, or anything else you would wish to add?
Yeah, I think if you're dealing with addiction, and you're at that point where you're admitting it and you're telling yourself and you're being honest with yourself, I would just encourage you to know that it's possible to break that addiction, and to seek out functional medicine as part of one of the many tools that you're going to want to need and you're going to want to have. It works.
Mhm.
I've seen it work. A number of my colleagues have seen it work. The research shows that it works, again, to the tune of 50-60%, right? So like that's pretty good odds with just niacin and vitamin C. Now add all those other things we talked about today,
Mhm.
and the success rates go way up. So I just say don't despair, right? Sometimes with addiction you can get depressed, you can get very despaired. It's a tough road to come out of, but the number one criteria to get better is to have hope. And
Yeah.
I hope that today, hearing some of this information gave you hope, and gave you at least a partial roadmap to begin the process of investigating what you need to do to get yourself on the right track.